When you're talking minimally invasive surgery for women, you have to stop first at minimally invasive. If surgery needs to come, that's one thing. But if surgery can be avoided, if the woman can be treated medically, hormonally, that needs to be a first step. If the process goes on and surgery is indicated, then the process needs to be looked at of what is the least invasive procedure that can be done to accomplish the goals we're trying to get. If you're talking about abnormal bleeding, it can be anything from adjusting hormones to an endometrial ablation to a DNC to even possibly a hysterectomy. It's a matter then again of looking at how can this be done with the least invasion possible. An abdominal hysterectomy has been the standard of care for years, and there's still a large number of women that have abdominal hysterectomies every year. That entails a longer recovery period, and it is a very invasive procedure. Laparoscopic hysterectomies or vaginal hysterectomies are much less invasive, much quicker recoveries, and therefore better for the patient. Part of looking at the whole picture, it's not just picking a procedure because I like this procedure, it's customizing the patient's body size, the size of the uterus, how long this has been going on, the possibility of scar tissue, all play a role in deciding what will work best and what will be the best for the patient. Sometimes there's lifestyle changes, sometimes there is just a matter of exercise. I mean, there's lots of things that need to be looked at, and that's where we try to look at each individual woman and see what is going on in her life that might be adding to issues she's coming to the office complaining of, and how can we best address those. Preventative medicine is still the best. Regular office visits with your physician. There's changes now with how often a pap smear is recommended to be taken. But that doesn't mean you shouldn't come in and see your doctor, your gynecologist, on a yearly basis. One of the biggest things that can help is just keeping a simple menstrual calendar. Jotting down on a piece of paper, on a calendar, on your smartphone, when your period starts, when it stops. So that when you do come to a physician, if you think your periods are irregular, you've got an actual timeline that you can say, this is how often it's happening, and this is how bad it is.